Hi everyone, and welcome to this special edition of MHTV. I'm Dave Munday, Lead Professional Officer with Unite Union in the Health Sector, and I'm joined today by a fellow, more regular presenter for MHTV, Nicky Lambert. Nicky, before we introduce today's guest, can I come over to you so you can introduce yourself and tell people how they can be involved in today's episode? And for anyone who hasn't seen it before, this is episode number 43. So over to you, Nicky.
43 already. Shocking. Thank you very much for joining us today, everybody. We'd really love to hear your sort of thoughts, any questions that you've got for this fantastic panel. If you're joining us on Facebook Live, please just put your comments in. I'm monitoring that as we go. And if you're catching up or looking at this on Twitter, if you follow the hashtag MHTV, I'll pick up any questions or queries that you've got there. Thanks very much. Cheers, Dave.
Thanks, Nicky. So we're joined by a stellar lineup of guests today to talk about what I think is a really important subject, the COVID-19 vaccination and severe mental illness. I'm going to go in alphabetical order and give each person a quick chance to introduce themselves. So Emma, you're first. Emma Bailey.
So I work at the Centre for Mental Health and I project manage Equally Well UK, which is a campaign basically with a growing membership working on the physical health of people with a severe mental illness to help close that early mortality gap.
Brilliant. Thanks, Emma. And Ethel Changa.
Hi everyone, I'm so pleased to be here. My name is Ethel Changa. I work as a clinical nurse advisor on the COVID vaccination program and happy to be here.
Thanks, Ethel. Marsha McAdam.
Marsha McAdam. I'm a member or lived experience member of Equally Well and a mental and physical health advocate.
Brilliant. And Dr. Shona Mckinnon.
Hi everyone, thank you so much for the invitation to be here today. I'm Shona, I'm a National Medical Director's Clinical Fellow and I've been working as part of the National COVID-19 Vaccination Programme over the past 4 months.
Brilliant. We were also hoping to be joined by Nikita, who is someone else with a lived experience and expert by experience, but she's not joined the Zoom yet. I'm going to try and keep my eye on my computer. Oh, I think she may be joining now. So we'll hopefully draw her into the conversation in a second. Let's see. Hi, is that Nikita? Hello?
I guess just as we are getting Nikita on board, it might be useful for us just to establish, what a vaccine is. Is it possible to do that?
Yeah, so let me start again, sorry. So on the 8th of December last year, Maggie Keenan was the first person in the world to be given a COVID-19 vaccination outside of a clinical trial. And since then, as of Tuesday, the 23rd of March, 28.3 million people have received their first doses. And of these, 2.3 million have received a second dose. So today, though, we wanted to focus on the COVID-19 vaccination and those people with a severe mental illness. But just before we do that, I wanted to ask either Shona or Ethel, what is a vaccination and how does it work?
Yeah, thanks very much, David. I'll pick up that question and Shona can expand on it if need. But in a nutshell, so a vaccine is a type of medicine that trains the body's immune system so that it can fight disease. And we do know that vaccines are designed to prevent disease rather than treat a disease once it's been caught. So in a nutshell, that's what it is.
Brilliant. So early last year, talk was that it would possibly take till sort of late 2022 to get a suitable vaccination against COVID-19. How is it that we've got a number of different vaccinations so quickly? And should we be worried about the speed in development and the regulatory approval?
Thank you. So I think it's important to be really clear that there is no need to worry about the speed at which these vaccines have been developed or approved. So all medicines, including vaccines, are highly regulated, and this is no different for the approved COVID-19 vaccines. There have been a number of different factors that have made the speed of the development of these vaccines possible. These include things like the different phases of the clinical trials were designed to overlap instead of running sequentially. There was a role rolling assessment of the data from the clinical trials. So data was given to the experts at MHRA as soon as it became available so that they could review the information as the trials were being delivered, ask any questions along the way and request any information as needed, as opposed to waiting until the end of the trial to get all of the information. And also the clinical trials were able to recruit people very quickly. The global effort meant that thousands of people were willing to volunteer to be part of these trials, and over a very short space of time, clinical trials were able to recruit over 44,000 people across the world.
Yeah, it's just been such an amazing job, hasn't it, to get it done so speedily, and obviously just such an amazing undertaking. Now, obviously, we've got a fair few million people in the UK that now we need to get vaccinated. How have the decisions been taken on who should get the vaccination and in what priority order?
Thanks. So these decisions are made by JCVI, which is an independent expert advisory committee that advises the UK health departments on immunisation. And there's a lot of information published about the rationale for their decision making on the government's website. But broadly, these decisions are based on an approach that saves as many lives as possible by vaccinating those who are at most risk of becoming seriously unwell first, as well as health and social care staff. And using this approach, JCVI has started off prioritising based on age and also based on those with underlying health conditions that make them more vulnerable to COVID-19.
Brilliant. Now, Emma, I want to turn to you now. So we've heard about how the JCVI have worked out in what order people should get vaccinated. What part of the list are people on who have severe mental illness, and why are they there?
Okay, so people with a diagnosis of severe mental illness are in group 6, which is the current one at the moment. It started in February. And anyone over the age of 65 should have already received it in the previous bands. So the main focus is anyone with a severe mental illness under 65, or those that hadn't yet received it. The reason is that evidence, particularly among those who have a psychosis, have a higher mortality rate of 3 times the general population from COVID. Based on this evidence, they've been included. However, we also know that people with severe mental illness all too often have comorbidities, and their physical health can often be worse and early mortality. So based on this, they're included within the band 6. Following talks that we had with NHS England and PHE, Equally Well actually did a resource for people with a severe mental illness and their carers as well, just on what to expect for the COVID vaccination to help them, which is, we've received a number of different calls and emails on that.
Brilliant. And yeah, your guide's really helpful, and I know we've advertised it to MHNA members, and we'd certainly encourage anyone watching today to pop along to the Equally Well website and download a copy. So that's brilliant. Now, Marsha, and if you've joined Nikita, just a question to you guys now. I know you've both had your first of the 2 doses of the COVID-19 vaccination. I just wondered if you could talk us through how you were contacted and the booking process, and how the first appointments went.
I was sent a letter saying about being in group 6, but in the same time, my community mental health nurse contacted my named GP, and the GP, who, like I say, is named, so he knows that I had chronic fatigue, asthma, type 2 diabetes. I also had right ventricular tachycardia a few years ago, which then meant I had a catheter ablation, and the dreaded O word. I was the label of obesity, and also my mental ill health. So I was brought in a few weeks earlier than those in the group 6, and I felt a little bit of a guilt. I remember saying this to Nikita and that the other day, that I felt quite guilty about why were other people with the diagnosis of borderline personality disorder, or otherwise known as EUPD, they're sort of there was a point where it wasn't within, it wasn't recognised within SMI. And I know that the Centre for Mental Health and others did quite a bit behind the scenes, which I'm really thankful for. But at the time, I did feel like, well, surely someone's more deserving. But I guess that's just me as a person thinking that, because there's so many that need it, isn't there? So I guess that was, sorry if I'm waffling.
No, absolutely. And I think the point of guilt, I don't know if any other on the panel want to think about this later, but, having spoken to lots of people, working at a vaccination centre, people kind of saying, oh, I didn't know whether I should wait to have my appointment because I think other people need to have it first. But I think it's just really important that, people, when they're asked to get in touch and not kind of worry about that. But, sort of thanks for sharing that. Nikita, are you on the line? No, I don't think she's there. So we'll just carry on with you, Marcia. So in terms of you having that first vaccination, how did the appointment itself go?
It was so smooth, and the way it was almost regimental, you go. I remember before the appointment, my CPN had found out if my son could get it as well at the same time as he was my carer. So he was initially told yeah, and then for some reason no. And then when I was at the appointment, someone shouted, "Does anyone have a carer?" So I put my hand up, and then my son got a text or a call and was in within an hour having his jab. And I remember, we had to go and wait, or I had to go and wait outside, for those 15 minutes. There was this one woman who was so caring. She was one of the volunteers or that. And it was just her kindness I'll never forget that. And everyone that gives their time, like people like yourselves and that, outside your normal day job and that, I really, really appreciate it because you already have so much on. So yeah, you are just angels.
Oh, thank you. That's really kind of you to say that. I think, having been working at a vaccination centre a few days a week, it's a really privileged place to be. It's really nice to be a part of it, and especially seeing all the people coming in and kind of having the vaccination and, the sort of gratitude that's there, but knowing that everyone that does it is playing, a small part in making, such a big improvement for the country. So in terms of that first vaccination, did you find that you had any side effects afterwards?
So one of the things I can definitely suggest is don't lay on your arm. My friend told me that, and stupidly I lay on my arm. So it really hurt for a few days after. I had achy body and very fatigued the day after, but I put it down to my fibromyalgia and chronic fatigue, whereas I spoke to my CPN and he's like, oh, that would be an after effect of the vaccination. I had the Pfizer one, and yeah, I just take my hats off to the people that invented it, and from there on, everyone else. You've given me, I feel like having the jab is giving me hope. I can actually see myself getting out the house and going meeting friends and stuff like that. So I just really encourage others to please go and have it.
That's brilliant. Thanks. Now, Nicky, I hope you don't mind me saying that. I know you're an AstraZeneca user. How did that go for you?
I don't think anyone has ever described me as that before, but thank you very much. Yeah, I did. I had my jab on, which we're not supposed to call a jab, by the way, so stop saying that, Nicky. I had my injection on last Thursday, and I did feel pretty nauseous afterwards, which I hadn't properly looked into, so I wasn't completely expecting it. On the other hand, I have had friends and colleagues who've been really, really, really unwell, and I know people who have died. So I feel so incredibly grateful and lucky that people took the time to, deliver that injection as quickly as possible. And I had no problems actually getting booked in, no problems waiting, other than a bit of soreness, which is a very small price to pay. I've got no complaints, just thanks, really.
Yeah. Well, I'm a Pfizer user, so I didn't have any side effects after my vaccine, which I was quite surprised at, really, because if there's a side effect going, then I'd happily have it. But yeah, no, I was absolutely fine. I don't know, Shona and Ethel, have you got any comments on the side effects? What we're describing today, sort of usual or not?
Yeah. So first of all, I just want to say thank you so much for sharing that, Marsha. It was really just so authentic and refreshing to just hear from you. So thank you for that. So some of the side effects that people have stated are things like soreness, which is what Marsha has also said, soreness on the site where you've had the injection. And also some people report a high temperature and feeling tired and fatigued. And usually these symptoms don't last longer than 72 hours. So people have a good rest or take some painkillers to just manage that pain that they're having. So those are the type of side effects that people have reported. Shona, I don't know if you want to add anything to that.
Thanks, Ethel. Just to say that some people do experience side effects, but most are very mild and short-lived. And sometimes you can think of it as that these side effects are showing that your body is making an immune response to the vaccine. So in a way, they're kind of showing you that the vaccine is working. But if you do get any side effects, as Ethel said, that taking painkillers and resting, and they should resolve within a few days. And you can always contact a trusted healthcare professional if you're worried.
Shona, just on that, is it important to say that for anyone that doesn't have any side effects, then that's not a bad sign, that it's not saying that it's not been done properly or something?
Yes, so only a small proportion of people experience side effects, and so it's completely fine whether you do or don't experience them.
Yeah, brilliant. I suppose the other thing to say as well is that the vaccination's given in a healthcare setting, isn't it? And I know at Manchester we're fully set up for any problems that people might have after any immunisation. So in the exceptionally rare case that there was any problems, then it's fully staffed with really well trained health professionals. And I've been working at the Manchester site for many weeks, and we've had some people that have maybe fainted after the jab, but nothing more serious than that. And obviously they've all left afterwards with a full bill of clean health, really. So coming back to you now, Marsha, obviously you've had your first vaccination. Have you got any advice for people that are listening in that are providing vaccinations, or anyone that is going for their first vaccination, in terms of how the experience could go more smoothly? So I know, for example, you said don't lie on it, but have you got any other kind of tips and hints in terms of how we can make the vaccination process a better one?
Firstly, last week, so I had mine 3 weeks ago, Saturday just gone. And then on Saturday, I woke up and I was feeling my whole body was itching. So straight away you think, oh, is that because of, but I believe you only have a reaction, don't you, within the first few days, but straight away you sort of think, oh, with all the misinformation on the news and everything. So there was that. And then I wouldn't change anything about how it was done on the day, because I couldn't fault it in any way, the whole process. And I wish all our NHS could be like that every day. It was just so meticulous the way that they did it, and people were genuinely friendly. And you could feel that. I would also say to people listening in, please check reputable sites like NHS, like Equally Well, where they will give you proper information. Please don't pay attention to what's on the news, and because in my opinion, it's quite scary. And so, yeah, I don't know if you sort of agree as well that the scariness then feeds on, doesn't it, to more and more fear?
Yeah, and I suppose, have you got any advice in terms of people that might need some sort of things to help them get through the vaccination process? And I suppose Emma might want to jump in here as well in terms of, kind of reasonable adjustments that people can make. Just as an example myself, I know when I went for my vaccination, I do have a bit of a fear of needles. I'm happy to give them and draw them up, but I'm not a fan of having them myself. And I just kind of said, when I went through, could they just make sure that they did it while I was sat down, and, just kind of ask for a few things to be a bit different for mine. Have you got any suggestions, Emma or Marcia, of kind of other things that people might want to consider?
I know that, especially on Twitter, you see, and people are really worried that if they go and they have to expose their arms where they've self-harmed, and the people's reaction, but there's been a lot of comments how people were not judged in any way or that, and I think someone even said, do you want me to try on the other arm? So that's something that I'd really like you to sort of bear in mind. And the person also then said, well, will it hurt more, because of all the scarring and that? So people are actually really thinking about these things. So, just about people not being judgmental.
Yeah, that's a really good point. And I know in terms of our centre, we have screens available, and, people will ask to use the screens. So, they've got a bit more of a private space where the vaccination's done, and absolutely encourage anyone that wants to, ask for that, absolutely do. Emma, have you got any sort of suggestions on things that people could ask for?
Yeah, so just to say, it's suddenly very sunny where I am, which is brilliant, but apologies for squinting. We've had mixed reviews from people. So the majority of people have said they've had really good experiences and they've been supported, but we've had one or two other people that have shared that they didn't know why they were booked in for their vaccination, and it caused sort of confusion, and they also felt guilty to others that weren't able to have it with the same diagnosis as them. And then we've also got one or two people that have shared that there wasn't any flexibility in terms of when they could go. So one person who's a mum had to go on a Sunday evening as a single mum with her children. And it was around the time that they would normally be having tea, like their dinner. And so that was a bit of a tricky one. Instead of being given an appointment that was in the day when her children would be elsewhere. So I think it was just that thing of being mindful about maybe seeing, if possible, to be flexible. We've also heard from one or two others that, especially if you've got dyslexia or something, filling out a form. I know that some centres have forms and some don't, can be quite tricky. One of our expert by experience members, he shared that he actually ticked the pregnancy box without quite realising, and then a nurse was really supportive and then helped him with the form. We've heard of other people that have got physical health problems as well, and they've had to wait in queues and not been given a seat or something, or anxieties. And there's one or two other people that have said that they can't wear a mask and they've been told they have to in order to go in, but due to different conditions they're not able to wear a mask. So I think it's just bearing in mind that not everyone's the same, not everyone can wear a mask, and not everyone can stand for long periods, or some people, like you say, have phobias of needles. So I think it's just factoring that in. I do understand, however, how busy everyone is at the vaccine centres and GPs, but it's just maybe taking that little bit extra time to support the person.
Yeah, and it's a shame to hear about the bad experiences, because I know, sort of having witnessed the centre that I work at, that we would really hope that we kind of accommodate all the kind of issues that you've raised there. You know, having people, we've got lots of volunteers that, you know, are up for having conversations about stuff like that. And, you know, if at the front of the centre, you know, someone kind of says, oh, I just need this extra support, you know, volunteers will kind of follow them through the whole process. You know, wheelchairs available for those that can't stand for long periods of time, you know, that kind of stuff. So yeah, it's such a shame that not everyone gets that experience, because that's what they deserve, isn't it? So I don't know if there's any sort of comments that Ethel or Shona wants to make on anything that we've just been talking about in terms of reasonable adjustments.
Yeah, first of all, just want to say many thanks to you, Emma, for just giving that feedback there with regards to reasonable adjustments. And as a program, we're absolutely prioritizing making sure that everyone has equitable access to the vaccine, and that we're making the reasonable adjustments that we need to. So hearing feedback is really, really important to us, because obviously in the program, we're evolving, you know, as the program moves along really rapidly. But it's something that's certainly in the priority of our list of things to do. So thank you very much for that feedback. And yeah, we'll certainly taking that on board. Shona, I don't know if you've got anything else to add to that.
Thank you. Yes, I guess just to echo what everyone said, and thank you for the feedback. And I guess as well, it might be valuable for people to contact or to ask for any adjustments that they might need when they're contacted to make the appointment. So if you would like a longer appointment time, or one later on in the day, or if it might be helpful to have somewhere quiet to sit while you wait for your appointment, things like that, are all adjustments that can be made. And as Ethel said, it's really important that we are as flexible and as adaptable as possible to try and support as many people who would like the vaccine to take one up as possible.
Brilliant. Now, Emma, I wanted to come over to you about the issue of SMI, severe mental illness, and the COVID-19 vaccination. Now, the JCVI have defined SMI as individuals with schizophrenia or bipolar disorder, or any mental illness that causes severe functional impairment. Have you got a few thoughts on what that means?
Very good question. So when we heard that people with severe mental illness were being included in the Band 6, we were absolutely delighted. And there was that sort of debate slightly on whether or not to challenge it slightly and ask more questions around the severe functional impairment. However, having spoken to NHS England, they've said that they're encouraging GPs to be open-minded when it comes to the vaccines for people with severe mental illness. So this also includes if you've got an eating disorder or borderline personality disorder as well. So we felt quite relieved with that. We have had quite a few people though, however, especially since I put out the Equally Well resource, that have had mixed experiences. So we've heard of some people with an eating disorder that have been given the vaccine with no problem and it's been really great, and then others that have called their GP and they've been told that they have to wait for their age group. From the sort of discussions that I've had personally, I've quite often shared with them some of the different evidence. So the Equally Well guide, there's a blog now that's come out from NHS England, and there's also a few other things that have been put out there. And I'm working with PHE on a video that should be out soon. It's just waiting for final sign off. And so sharing some of the evidence, some of the people have then gone back to their GP surgeries with these evidence and then been booked in for a vaccine, or on occasion being told they still have to wait. So I think there's a little bit of mixed experiences for people out there. Hopefully now that the blog went out yesterday, that might encourage GPs more to accept anyone with a severe mental illness, because I understand some of them weren't entirely sure before. So it's been I think the way that we've put the vaccine out so quickly has been brilliant, but obviously there's a lot for GPs to take in. So it's just one of those things on the messaging to be that anyone with severe mental illness to be able to receive it. And I think we're just really pleased that NHS England have been vocal in the fact that GP surgeries should be open-minded.
Yeah, this isn't official NHS England advice, but it might be worth anyone that is having problems to tweet Claire Murdoch, because she's quite good at tweeting back, and maybe taking that tweet to the GP and saying, you know, look, the lead for mental health at NHS England is saying this, so surely, you know, you must agree with her. But like I say, that's not official. Ethel and Shona, have you got any maybe more official advice in terms of if people are having problems getting access through the SMI?
Yeah, you can go ahead, Shona.
Thanks. Just the main thing I would suggest is encouraging people to speak to their GP or to their mental health team if they have one. And GPs, as has been said, are encouraged to keep prioritising people with mental illness and to apply a flexible approach to defining SMI that's been discussed. It's also important to note that the NHS is working closely with secondary care mental health services and encouraging secondary care mental health services to review caseloads to identify people who might struggle to respond to a GP invitation letter, for example, and also to ask individuals at secondary care appointments about the vaccine and whether or not they've managed to access it, and also provide any information or support that's required.
Brilliant. So, Emma, what's the situation for unpaid carers?
Very good question again. That one, it's a little bit of a mixed bag again. We've heard, this is mainly from colleagues at Rethink who are partners of Equally Well, that mechanisms for carers to be registered at GP surgeries differ, and they've been hearing quite a lot on how not everyone is being contacted, or some carers haven't been able to receive the vaccine yet. So what we're trying to share as much as possible is just to share that carers are entitled to it. And hopefully GP surgeries will be open-minded on that. I've spoken to one or two carers who didn't actually know that they would be entitled. So based on that, they've gone to their GP and been able to book in for the vaccine. So I think it's quite important that carers are kept in the loop on this one.
Yeah, and I know it was good to hear before when Marcia mentioned that her carer did get their vaccine. It sounded a little bit of a fluke, but obviously, hopefully for many more people, it'll be a much better kind of process that they go through. Emma, I know we were hoping to have someone from Rethink today, but they're not able to join. And I was quite keen to hear about the research that they did in terms of people with SMI and the COVID-19 vaccination. So I think you've been primed to give us a few kind of thoughts and feedback from the Rethink work. So go for it.
I have been. And Gabby, who works on Equally Well with me, I work quite closely with her and she led on this piece of work. So I was more than happy to answer on her behalf. So in mid-January, Rethink Mental Illness created a survey online, which was sent out via social media through Rethink Mental Illness, lived experience networks, as well as NHS England Improvement, and Equally Well also helped support it. It included a mixture of open-ended and multiple choice questions and was open for 2 weeks. And it had 390 people with a diagnosis of severe mental illness and carers of people with severe mental illness fill in the survey. So just to give you the key headlines, 3/4, 75.4% of respondents said they were certed or very likely to get the vaccine. Recommendations, so clear information and communication to people with severe mental illness, NHS guidance to GPs. Sorry, I think I've just read that wrong. So basically what she was saying is they put out recommendations that had clear guidance and communication to people with a severe mental illness, NHS guidance to GPs to be as clear as possible, and active effort and research for BAME groups as well.
Brilliant, thank you. Now, I suppose one of the questions that I wanted to bring over to Ethel, and actually before that, Nicky, have we had any social media questions come in, or is everyone happy with what we've been saying so far?
There's waving and smiling, but no questions yet. So thank you very much, guys.
Cool. One of the questions that I did want to ask to Ethel and Shona is a bit about, obviously some of us on the call today have had our first vaccinations or second. Does that mean now that we can rush out, go and, meet with people, do anything that we want, or do we still need to be a bit careful?
We certainly, just to quickly answer that, Dave, we certainly still need to be careful. We still need to maintain all the IPC guidance that is out there, i.e. social distancing, wearing of masks, washing of hands, absolutely paramount. So yeah, so that's the message there. So continue with the IPC measures. Thank you.
Yeah, that bit about it don't matter if you've had a jab or not, we're following the roadmap. So, we can't kind of jump ahead bits on that. Obviously, we're kind of running towards the end of the time today, but I wanted to check whether any colleagues felt that we've missed anything, or there's anything that we said today that needs to kind of be clarified or challenged. So I don't know if it's worth, Nicky, have you got any thoughts in terms of final wash-up comments?
Anytime that you are potentially queuing or anything like that for NHS services, take a book or an iPad or your phone with you, something like that. Do what I do when anyone comes towards me with an injection, which is to smile at them and then look completely in the other direction until it's finished. I give injections, don't like getting them. Nobody loves it, but it's so important not to put yourselves and the people around you that you love and that we're a community at risk, because we just don't know. So please get information from solid sources. The other thing I'd say.
Marsha, have you got any final thoughts or anything that we've not covered that you hope to talk about today?
Just if you get the date for the vaccination, don't feel guilty that your friend a mile down the road hasn't been given it or that. And just be kind to yourself.
Brilliant advice. Yeah, absolutely. Shona, do you want to go next? Have you got any final thoughts to wrap up?
Thank you. Yeah, just to say that we'd obviously encourage all of those who are in priority groups to access vaccination to protect both themselves and the wider community. But would also recognise that there are some individuals or communities who might be worried and might want to take a little bit more time to decide. And there's a lot of resources out there to support you in making your decision. And you can always speak to your GP or another trusted healthcare professional if you have questions. I think it's also important to remember that this is an evergreen offer, that the vaccine is always open to you. So if you have previously refused a vaccine and you change your mind, you can still get one. And I guess the kind of take-home message is that these vaccines are safe, they're effective, they save lives, and the NHS is here to support you to receive your vaccine should you choose to have one.
Brilliant, thank you. Ethel, have you got any further comments?
Yeah, just want to echo what's already been said, and also just to specifically echo what Marsha has said, really around getting the proper information, getting to the right sources and because there's a lot out there in social media and everywhere else. So just echoing what Marsha said with regards to go to the trusted sources, i.e. Public Health England, NHS England, and all the other trusted sources where you can get factual information to make an informed decision. And I'm also really pleased to have been part of this conversation today, because I'm also a registered mental health nurse. So this is something really close to my heart, and really thankful for all the feedback that I've heard today, because absolutely we want to ensure that we make the reasonable adjustments that are necessary for people to be able to access the vaccine and to be safe for themselves as well as for the wider community and population. So really pleased to have been part of this today. So thank you.
Brilliant. Well, Ethel, it's official that we liked you even more than we did at the start, that you're a mental health nurse. So that's brilliant. Now, Emma, you get to be the first person with the final thought. So anything that you want to kind of wrap up with after what have been some brilliant messages today?
I think more just to echo what everyone else has said, really, in the fact that I think anyone working at the vaccine centres or on COVID wards is doing an absolutely amazing job. I personally am so grateful to have the NHS and everyone that's played a part in it. But I think we also just need to make sure that people with severe mental illness are supported where possible, and that GPs are reaching out to them. We've had all too often that letters quite often won't work, especially if they're in brown envelopes. So to try reaching out through a text message or a phone call, and use different methods when reaching out a second time to someone with a severe mental illness to have their vaccine. And we will just keep helping and supporting where possible.
Brilliant. And as always, just thanks to the Centre for Mental Health and Equally Well UK, because you just do such a brilliant job with all the work that you get involved in. So, thank you from us to you for that. It did remind me of something you've just said, Emma, as well. I just wanted to say before we wrap up, obviously the COVID vaccination is free. So don't, if you get any messages saying that you've got to give bank details or, to pay for it, then that is a hope, that's a fraudulent thing. So, it is completely free. So that's it for today's episode. Thank you so much for the guests that we've had on today. Your time has been absolutely so valuable, and I've really enjoyed, whilst being a bit nervous, sort of leading on today's episode. Next week, next Wednesday, 31st of March, my birthday. So looking forward to that. But also, because we've got Sam Darney-Smith on the next MHTV, and she's going to be talking about people who experience homelessness. So if you've not already booked an episode reminder for that session, then please do. But from me, from Nicky, from all our guests today, thank you so much for joining in, and we'll see you next time on MHTV. Bye.
Take care. Bye-bye. Bye.